Good afternoon, and thank you once again for tuning in to my weekly COVID-19 updates. Today, I've invited a special guest to join me, our Superintendent of Schools, Sean Gallagher, and we are going to spend this session talking about the reopening of schools. But just a couple quick updates before we move over to discuss the schools. Just wanted to remind people that we are still very much dealing with COVID-19 situation. You can see the surges that are happening in places across the state and across our country. We have done a really good job in Newburyport in terms of flattening the curve and keeping our numbers down. To date, we have 119 total cases, and currently we have only 2 positive cases. This is really good news, and let's keep it that way. But we've run into problems with downtown along the boardwalk, the rail trail, and the downtown areas where it's not possible to do social distancing. So we have created, through emergency order, a mandatory mask zone. And I'm asking that everyone please comply with wearing a facial covering or mask when you are in this area. Over the weekend, I have additional ambassadors who will be out encouraging people to wear masks and will be passing out masks. So this is really important, and it will remain in effect until further notice. Thank you. Superintendent Sean Gallagher is here with me today, and he has been extremely busy all summer working with his leadership team and broad-based community input on creating the best and safest plans for us to reopen our schools on September 16th. Before I turn it over to him to sort of give us a high-level overview to start of the process, I just really wanted to thank the members of the school community, Sean, his leadership team, all of the people who have stepped up to be part of the 70-person reopening task forces and put all their efforts together to develop this comprehensive plan. The plan is now posted on the city website and posted on the school website, and I'm sure other sites. And I would encourage everyone to look at the plan, and then please join us on Monday, August 17th, where the school committee will be voting on the reopening plan. 3 plans have been put together, a fully all-in, hybrid, or remote. And the plan that is before us to seriously consider is a hybrid plan. What I think is really important for everyone to remember is that, and we can't say this enough, that these plans are fluid. The reason that we're starting with this reopening plan is because we want everyone, parents, teachers, students, administrators, to get familiar with all the new practices, policies, and procedures that are in place to keep everyone safe. This is a plan for reopening the school with the intent of reassessing on an ongoing basis. Our overall goal will be, and always will be, to bring all of our students back into the schools for face-to-face learning when we can do it safely. Superintendent Gallagher, thank you for joining me today.
Mayor Holaday, long time we haven't talked. It's been about a half hour.
Yeah, at least. Obviously, we've had a lot of communication over these last many months about where we're going with the reopening of school. So if you could start and just tell us about how you started this process.
Well, as you said, we want to thank our administration. I don't think anyone's taken a day off all summer, been putting in many hours, 10-hour days. But I think from at the end of last year of school, recognizing the importance, I think really the general essential question for us, regardless of the virus, is how are we going to reopen schools, but with the idea of how important in-person instruction is. So that's really, I think, the essential question for us that we started work all the way back in June on what will in-person look like. But as you said, Mayor, the number one piece for us is the safety and the wellness of the staff, the students in our school community. So for us, that was really the focus of if we are going to bring students back and staff back, we want to do it in the safest manner. So all of the planning that we started with that was around those two really important aspects. For us, and as you know, we're adjusting to a lot of new information. You know, a lot of the guidelines from June are a lot different than August. So I think every week, as we were developing plans and really working hard, there was probably, I would say, hundreds of iterations of every single plan that we've been doing. And for us, the new guidelines, that there was initial guidelines that came out at the end of June, then the fall guidelines came out around mid-July, then we had transportation guidelines at close to the end of July, then we had facilities guidelines. So as we're talking about the planning process, every time new guidelines and recommendations around safety came out, we're adjusting plans to meet those guidelines. So for us, I think that's been really the challenge of new information every week. We feel.
And speaking of that,
yes.
just this week,
yes.
The Department of Elementary and Secondary Education and the governor came out with this map showing three, levels of, red is where you go all remote,
right,
because you've got over 8 cases per 100,000 people. If you're between 4 and 8, you're in the yellow, you do hybrid, and then if you're in green, it means you have less than 4 cases and you should do all in. And I think all of us have received emails with those maps, and obviously we've all been educated on those maps.
Correct.
And have been part of way too many Zoom meetings with state officials on a variety of issues, including opening schools. But I think the important piece about that map is that it's one factor. It's one piece to look at. We are very fortunate that our community has very low numbers, but we also have to consider, a multitude of other factors as we open the schools. And maybe you could talk about some of those other factors that you considered while you were planning the reopening plan.
Yes, if you just look at the complexity of what we're trying to do. So we have 2,300 students from ages 3 to 18 with various academic backgrounds, but also various health needs and individual needs. At the same time, we employ approximately 500 employees, from teachers, IAs, custodians, secretaries, support staff. So just that alone is, as we take a look at bringing students back, it's really focusing on, really on the health and safety. But for us, what was really important is we took those initial guidelines, we started to develop our planning, but as you said, Mayor, bringing our task force together, about 70 different people within the community. We had teachers, administrators, parents, guardians, we had business owners, and a lot of great medical personnel. And I can't say enough about the people that have been helping us that came out of the woodwork to help the task force. So we took the task force as we look at reopening from we had a district focus, we had a curriculum instruction focus, we had a health and safety focus, we had a social emotional focus, special education focus, and then facilities and operations. So we were very fortunate with all of those people that were participating. We had expertise in all of those different areas, which was really helpful in giving us a lot of different guidance in all of those areas as we're talking about reopening schools in not only the safest way, but under the different models, looking at continuing the academic integrity of instructing students. So with that being said, we had health and facilities group were assisting us with looking at student schedules, looking at the classrooms, and giving us advice on movement, practicing the physical distancing, what a classroom is going to look like. And that also helped us really start looking at designing the hybrid model. For right from the start, we recognize when you one of the guidelines was full in person with 3-foot distancing, and what those classrooms would look like was pretty. Very tight, and then that added a lot of complexities around lunch, arrival, dismissal, and really didn't fit into the CDC guidelines and the state guidelines. And then our health professionals, we've had Dr. Sue helping us, and she's an epidemiologist out of Harvard Epidemiology School, and is actually writing some data reports for Dr. Fauci. So. That's a pretty good person.
Absolutely.
And more importantly, she also has 4 children in the system, 1 at every building. So she's looking at it, I think, also as a parent. And there's so many other professionals that have helped us, but like Michael Allard was also been instrumental in the health and wellness as part of the pandemic, reopening hospitals, and he helped build the Hope Hospital there in Boston. So, and he had to develop safety protocols for all the doctors, the nurses, along with all the other people in the hospital. So he's been also instrumental in assisting us with safety protocols that are in place at the hospitals, but then adjusting them to the schools. And I think the #1 goal for us is the reopening. We're looking, as you said, Mayor, as a phase-in process. So our reopening is 2 very important aspects. I think one is to create the protocols of safety. So when people come into the building, we develop a comfort level of how school's going to look a lot different. And then the other piece that we really feel is important is the health and safety of all students and staff, but really having success of a reopening. What we're seeing down the south, people just open up the schools in Georgia, for example.
And then they're shut down.
Correct.
And the entire schools are quarantined.
Correct.
That's not where we want to be.
No. And I think, so for us, in working with the task force and the healthcare professionals, I think we've really vetted a lot of different problems or concerns through our hybrid planning. So that's been just one great benefit. The other piece is our social emotional piece. And what I think parents and the community really needs to understand and really think about this and wrap your head around this as a student. When our students left in March, from the elementary level, from pre-K all the way to grade 12, their understanding of what school is, with the collaboration, with the teamwork. If you went into the elementary classrooms, there was little bean bags, little reading stations, little umbrellas, little cubbies, and it was a very warm and welcoming school environment. I think that's really, really important. The other piece that's essential to learning is a lot of manipulatives, especially at the elementary school and the middle school and the Mullen, where students are building, even at the high school, robotics, and so all those manipulatives that students were using and to create. So now they're coming into a school system that we removed all of the non-essential furniture. We removed all of those manipulatives that students are used to utilizing. We removed all of the comfort seating of different areas for students to relax and so really when you walk into that classroom now, Mayor, you see desks. You have desks and you have a teacher's desk. That visual alone, we feel, and this is I think the work of our social emotional piece, is there's a mental aspect of this, of when students walk into the building, or even when teachers come back, they're going to see their classroom very basic, a lot different. And I think that's #1, that as we're reintroducing school to our staff and students. The other piece that's really important, Mayor, is the signage. So we're going to have signage all around. You're going to see the 6-foot distancing signage on the floors. You're going to see students obviously wearing all the masks and protocols. You can see teachers also with protective shields. And some teachers that are working with students with special needs may have gowns and for protection. So as we were working with not only Dr. Sue on the physical aspect and the contact tracing and isolation, there's a whole mental aspect to this. And I think it's really important for us to slowly reintroduce school to students and staff that they've they have not experienced. And I think that that piece is going to take some time of the protocols, of students getting and staff getting used to a different way of learning right now because of the virus. And for us, I think that that's the X factor that I think when we're talking to parents that did have concerns, and we've been reaching out and talking to as many parents as we can, but I think it's really not about the planning. It's not about necessarily, this schedule would work better because of this schedule. It's really, we're planning around an active virus. So you and I could come up with great plans that look fabulous. But then once we see the virus, we're actually planning around a virus. And as you said, Mayor, that's not going to change. The virus is not going away soon. And so for us, and part of our hybrid model and the reintroduction to school for students and staff and administrators and parents is part of that, where we have success, where people feel comfortable, people feel safe, and then we reevaluate. And
you look at the numbers in the community and in the state, and it's easy to move forward and bring more students back in and do it in a controlled, carefully planned manner.
Exactly.
Or in the worst case scenario, if a surge comes up, we would be ready to move into remote, but students have already made connections. That's why I think I am so supportive of the plan that has been put together, because I think that's one of the things where all the schools around us who are starting remote, they won't have that individual connection with the student. I think another thing I'd like you to talk about is the difference in the remote learning from abruptly shutting down schools and everyone scrambling to try and put remote learning together. What will be the difference this year in terms of remote?
Oh, I'll tell you, it's a major difference. And here's, we were thrusted into a pandemic. So, and people, say, oh, well, it's uncertain times. Well, no one's prepared for a pandemic. So in the spring, shutting down schools out of safety, and then really building our remote learning at that time, and not even really understanding how long we were going to be shut down. So originally, it was only going to be for 2 weeks, and then reevaluate. And then then the governor came in, we shut down for 3 weeks, and then there was another, then we shut down till May, and then finally. So I think for every time there was a shutdown, we started off in the beginning with just learning activities for enrichment, and then when the longer shut down, then we started planning more lessons, and then with a longer shutdown, then it was almost like building a plane while it was flying. And so for our faculty, who I really believe in the principals, really responded well. So at the end of June, we sent out a survey and to get input from parents and at the high school students on that remote and how we can make things better. So at the end of June, we took that information from parents and from students, and then this entire summer, knowing that there's probably going to be some of an aspect of remote learning, how can we do it better? Right. So we had, just so people understand, a lot of training's been going on. So we've trained over 250 teachers in technology to get ready for the remote this year, all summer long. We have 165 teachers that were doing the hybrid planning, that have been planning units for the hybrid, so understanding there's going to be half the students in and live instruction and then half remote. And so part of our plan that we submitted, you'll see those sample schedules where 5 days a week, our teachers are making contact with students, either in person or with the remote planning. So
and that's also something that's really different, because once in March everything shut down, everybody left.
Correct.
Nobody was in the schools. Everybody was working remotely. Teachers were trying to teach their own kids and teach and, do enrichment activities, and then trying to limp forward in terms of where we go. But in the fall, when school starts, all teachers will be on site.
Correct. That's our
a huge difference.
Right, and the other piece too, it allows for the planning and also a lot of the collaboration where you have teachers in the building as they're as we're moving forward with our hybrid plan, and then if we have to go to remote. So I think it's going to be I think that's the other piece, as we've been communicating with parents and families, a lot of parents are very nervous because they're assuming what happened in the spring is going to happen again.
And why wouldn't they?
Right, exactly, because that's all they know. Right. So I think, as part of our plan, we also just filmed, and I'd like to, thank the studio. We also just filmed with the principals, kind of, how they're going, every individual school and how that's going to look. And we're going to upload that and send out the link to families so they can get a little more detail from the principal point of view how each building's going to look a little bit different.
Right, which I think is wonderful. I think that's great. And I would encourage everyone to, the link will be posted for the Zoom meeting on Monday night, and there'll be presentations again from the principals and from Sean about this whole process. Please read the plan. It's up on the city website, the school website, and I think the communication and response to parents via email or phone calls has been, really remarkable. And today, Andy Wolf had met with half of the students and families, and now the other half later this afternoon. So, I think the outreach is really important to make everyone feel comfortable.
I agree, Mayor, and I think the other, there's a lot of misinformation that goes out there, and so we're really trying to explain to our community that the whole plan is really a phased-in approach, and our approach is going to be every month we're going to have to look at our data, and we're working with our health professionals that are on the task force of developing a checklist and a matrix for us that we're going to be utilizing to analyze, what's the next step. Our goal is to bring more students back to the high school and even bring more students back throughout the district if it's safe to do so. But I really believe that our plan, that we'll be presenting to the school committee allows us to reintroduce school to staff and students in the safest way, and then it's a building block to, as you said, Mayor, to increase. And and I don't want to compare our district to other districts that a lot of people do, but I think for us, it sets us up for a very successful year in the sense of dealing with an active virus, and which could always change, but at least I think we have the foundation to adapt to the virus and adapt to those health trends.
And isolating groups and cohorts, so we don't end up having to shut down a whole school system or a whole school.
Right, and I think that was the other piece, working with our healthcare professionals, the idea of having the ability to contact trace, the idea of having the ability to isolate, a case. And we also worked with Anna Jake's Hospital, who is willing to treat our teachers as first responders. Correct.
And will be able to get rapidly test should there be an exposure.
And I agree, and I think that was a big piece. As once a plan is voted on, I think those aspects of the checklist, and develop benchmarks throughout the school year, and then also if there is a potential exposure, just like you said, Mayor, it's very easy. It's easier for us to cohort a group of students and teachers, so you're communicating with 20 to 30. Individuals and not the rest of the school. And right, exactly. And that's exactly what happened in Georgia, for example, where they had a few cases in the high school, but now they're shutting down an entire high school for 2 weeks. And that was the other piece. How could you send high school students and staff home for 2 weeks and say you may have been exposed or you may not have been exposed, and we'll see what happens? And that anxiety, I think, on staff and students in the community would be tenfold. So our goal, as we said, is to develop the protocols in place that if there is a potential exposure, we can isolate, we can contact trace, and as you said, and we can treat.
And we can continue moving forward.
And we can continue
without
moving
shutting
forward.
everything down.
Exactly. So a lot of work has gone into it, and it's not over. As you know, as soon as we have a direction, then we're going to continue to work out all the fine details, because we also need to look at transportation. We also need, Pam Cayley's been doing a great job in food service with the lunches, and then Steve Burkholm and working with some some great parents on the facilities and making sure all our facilities are safe and cleaning protocol. So, and that's
Everybody
all in the
together.
plan.
Yeah,
That's all in the
everybody
plan.
together. So I encourage
Yes.
everyone to read the plan. Please join us on Monday night. Sean, thank you so much for joining me
Thank you,
today
Mayor.
and giving an overview of what's been going on with the schools. And I can't thank you enough for the hard work that you and your staff, leadership team, and all of the people who've been supporting the efforts to reopen our schools. See you Monday night at our meeting.
Probably tomorrow, too.
Well, that too. Yes. Anyway, thank you.